So this section just provides an overview of the Mass HIway and the benefits and services. So I just want to describe a bit about who we are. Again, the Mass HIway is managed by the Massachusetts Executive Office of Health and Human Services, or EOHHS, and that includes the design, operations, client services, general maintenance, and all that. We're governed by a diverse cross-organizational HIT council and informed by consumer, provider, legal and policy, and technology advisory groups. This is to promote a multi-stakeholder, transparent engagement model. Meeting notes and all of the presentations from those meetings are available to all at mass.gov. Now, the Mass eHealth Institute, or MeHI at Mass Tech, also ran our Mass HIway Last Mile program that ended back in February. The goal was to help providers connect and adopt the Mass HIway into practice. Now, the Mass eHealth Collaborative, or MeHI, served as the subject matter experts for that program. So both organizations support efforts to increase health IT and Mass HIway adoption. So whether you're talking to someone from MeHI or MeHI or the Mass HIway, it's okay. We're all working on this together. So our goal was to deploy a secure statewide health information exchange that's accessible to the healthcare community, regardless of affiliation, location, or differences in technology. It can be used for the purposes of TPO as allowed under HIPAA, and current eligible participants are Mass licensed providers, health plans, legal entities, and business associates. The big goal of an HIE is really to serve as a tool that providers can use to improve quality and patient satisfaction while reducing costs. Now, the vision is that by efficiently using a health information exchange, clinicians will have relevant, up-to-date information on a patient more readily available and in a usable format so they can make quick and informed decisions. So we know doctors become doctors because they want to provide the best patient care. But what surprised me most, certainly when I first got into healthcare, was the administrative burdens that medical practices are under. So whether it be in private practice or a large organization, there are many, many things that can get in the way of just being able to provide patient care. The biggest things that have come up when introducing another tool into a medical practice, like certainly an EHR or an HIE, is will it save time, will it help save or earn money so we can get back to providing patient care? And the thought behind an HIE is that yes, in addition to being a tool to improve care, over time, integration of an HIE can also help increase efficiencies and productivity, reduce costs, and help earn more revenue. So determining that value proposition is important and will depend on your practice needs and what the services are that we offer, and that's where the use cases will come in. So two-phase approach to development of the HIE. We have direct messaging services. That's the secure push of health information in an encrypted message from point A to point B. Those are available now. And we have query and retrieve functionality that allows query, location, and retrieval or pull of health information. These services were launched early in the year, and we're preparing for a wider rollout later on. The best way for an organization to really prepare for these services is to integrate direct messaging into practice. There's much more detailed information about these services available on our website here at masshiway.net. It's important to remember Mass HIway is not a clinical data repository. It's not a hub-and-spoke model HIE. Instead, we provide the secure network and the tools that providers can use to locate other providers and securely request, send, and receive information. We don't store the clinical data about your patients, and nor can we read any of those messages that are sent over our network. So a HISP, or a Health Information Services Provider, is that organization that manages security and transport of health information using the direct standards. It's a network that connects your EHR to other EHRs. So you need to be in that network to be able to send the messages. So the question came up as whether or not the Mass HIway is a HISP, and we provide these services. So yes, we do serve as a HISP. You need to trust that network. We established a trust fabric that helps to ensure that privacy and security and offers delivery assurance so you can feel confident that that data is protected and it gets to where you need it to go. And one of the biggest ways we intend to serve the community is being that network of networks. So we're working to connect with other HISPs as well as regional HIEs. Those networks have a ton of value locally, but the vision for the Mass HIway is to help providers within those networks connect to others outside of those networks across the state and eventually beyond. When you think about patient care, patients don't often see providers in the same area or within the same network, so the Mass HIway seeks to connect all of those. We are testing with several HISP, and we actually just first secured our first HISP to HISP contract, which is exciting because there certainly are many of them operating across the state of Massachusetts, and that's something you need to check with your vendor directly as to whether or not you can connect to their HISP or ours. So a big driver for connecting the highway now is meaningful use. We've got public health measures and the transition of care measure, which are the two big ones where the Mass HIway comes in. I want to take some time on this one. I don't want to go into the weeds of meaningful use because it's hard to get out once you do. But the DPH and the Mass HIway have partnered to transition all data reporting over to the Mass HIway. The key goals of this are to automate the data import process, simplify the administrative process, and remove as manual interventions as possible on that data. So this, over time, can reduce costs for you because you'll eventually be maintaining fewer reporting interfaces. So while there's no specific requirement in meaningful use that you need to use an HIE for your DPH reporting measures, here in Massachusetts, the only way that you'll be able to transmit data to the DPH is going to the highway. So for eligible hospitals, you'll need to be submitting your syndromic data over the Mass HIway. So regardless of what's happening with the connection, we'll need to have you enroll with us first and register your intent with the DPH to begin the process. For the measure, you don't have to achieve an ongoing submission, but you at least need to be able to show that you're working with us and the DPH. So if for some reason progress gets stalled, we have documentation that's available to back you up for your attestation. Now this come up a lot too, but this applies to eligible hospitals only. Eligible providers just need to print the link here that you see. There'll be verbiage on the page that will explain that here in Mass, this is only for eligible hospitals, and you use that for the exclusion. Immunizations is a core requirement for both EPs and eligible hospitals. So if you're currently on the HL7 clinical gateway and your vendor isn't ready to support data transmission to MIIS over the highway in time for your reporting period, you can continue to submit over the HL7 clinical gateway. I will stress, once your vendor is ready, we'll need to move that connection over to the highway, so you should really take that first step and enroll with us now. New providers are not being brought on to that gateway, so you should definitely enroll with the Mass HIway now so you'll be ready to submit to the MIIS. And for an EP, stage 2, there are actually a couple of registry measures, menu measures that have been added, and we have the Mass Cancer Registry and the Opioid Treatment Program over the Mass HIway for your new menu measures. We're also working on a webmail connection to the DPH, and if necessary, we'll install a LAN box and charge you only for that device, for that DPH connection, to make sure you're ready to meet these measures. Now for all of this, you'll still need to work with your vendor on the correct message templates, and more information on that can also be found there on that website. So while our primary aim is to ease public health reporting, we don't want this to be a barrier to meaningful use achievement. So documentation for exclusions may be granted on a case-by-case basis, but again, it's only if you're actively working with us and the DPH. So for transition of care, you'll need to transmit a summary record electronically. This is one you don't necessarily need to use the Mass HIway to do it, but we have a growing network of providers across the state, and we are providing a cost-effective solution to HIE. Another key driver is development of these pay-for-quality programs and risk-sharing models as supported by the ACA. Here in Massachusetts, for example, we have the new Primary Care Payment Reform Initiative. The providers in that program will use the Mass HIway as a tool to integrate behavioral health services into primary care, and we'll include some quality-based metrics there. And hospitals and provider groups will be exploring becoming accountable care organizations, and there's certainly been enough experience to know that HIE is a critical tool to the development of an ACO. And the Mass HIway serves as a cost-effective solution to an HIE because the infrastructure and the services are there to use. So with the ACA, that first step was to get people covered, and the next step is improve quality. and patient satisfaction while reducing costs by addressing key areas of how healthcare is delivered. So we have case management. It's that collaborative process that aims to get the patient all of the services they need to become and stay healthy. This is really important in treating some of the most complex and oftentimes the most costly patients. Mass HIway certainly supports this secure information sharing between all of the key providers and along with the payers who often manage some of these programs. Another key area is care coordination. And we hear about this one a lot because this is where we talk about these hospital readmissions and the duplicative testing, which are seen as some of the most costly and avoidable burdens on the healthcare system and the patient. So the Mass HIway is, again, that tool you can use to make sure that medical history and all the important information goes between the care teams. And quality reporting, again, is another area that the Mass HIway supports and offers that foundation for those quality improvement programs. So how are our participants doing on all of these use cases? Well, slowly but surely, we're seeing a steady increase in usage among each of these areas, as shown here from our November to mid-February transaction data. So we currently have over 200 organizations signed up and 100 organizations live, with many sites included under that. So in short, really, the Mass HIway is really starting to show some value in the community. And the more providers and organizations that get connected, the more valuable the tools will become. We do have our participant list also up on our website at masshiway.net. So connecting to HIE and integrating it into practice is hard. It takes time. But there's more recent data that the hard work can really pay off. Significant costs were saved, and there were improvements on key quality indicators in these instances just by using the HIE and related tools in a small percentage of encounters. So the key takeaway is, you consider the Mass HIway a tool that can help you do these things. And like with any tool, like your EHR, your organization as a whole is going to need time to plan for and adapt to it. And determining the right initial use case can help your organization really plan the effort and determine the value proposition specific to your organization. It can also help you understand the workflow considerations before you go through this massive organizational change. The goal is to really set the organization up for success.